and thanks so much for joining us this evening for our 2022 Community Health Education Series. My name is Zavanya Covington, and I am the Community Partnership Coordinator for Faith-Based Partnerships and Senior Strategies here in the Social Responsibility Department. I have some tongue twists today here at Baptist Health. Tonight, our topic is falls prevention. We have a video of the Saving Claire documentary prepared for you, courtesy of Ames Production. And we're also joined by some special guest panelists, physical therapist Bruce Cathcart and pharmacist Christine Randall from Baptist AgeWell, whom you will meet later on in this broadcast. But first, I would like to review our agenda with you. So we're going to review a few housekeeping items. We will view the Saving Claire documentary, followed by a Q&A and live discussion with our panelists. And finally, we will end with some brief closing announcements. So regarding our housekeeping items, first, we are recording tonight's session with the exception of the Saving Claire documentary video. This is due to our licensing agreement with Ames Productions. However, they are providing us with a separate link to the video that will be available to our registrants for up to 30 days following tonight's presentation. So the remainder of the tonight's recording and session will be available to you as usual. Secondly, we are tracking tonight's attendance. So if you've invited others to join with you who didn't have an opportunity to officially register for tonight's session, first we say thank you so much for spreading the word. And we just ask that you indicate the number of viewers within your group in the chat so that we can document it for our records. And thirdly, my director, Lynn Sherman, she will be monitoring the chat during the presentation. So please feel free to type your questions there and they will be addressed during the Q&A segment. So without further ado, we're going to get right to it. We now present Saving Claire, produced by Ames Productions. Please enjoy the film and we'll see you in 30 minutes. Again, feel free to type your questions and reactions in the chat.
Hello, everyone. So having watched the documentary, I wonder what you think about the decisions Claire made and if you were able to identify with her at all. Would you make the same decisions as Claire? We look forward to you sharing your thoughts, but before you share your thoughts with us, let's meet two falls experts, Bruce Cathcart and Christine Randall. Bruce is a board-certified geriatric physical therapist at Baptist Health in the AgeWell department. He has worked in the AgeWell department for 7 years. He is what is called a balance and gait expert. Christine Randall is a board-certified geriatric pharmacist. She has served in this role for 7 years, but has worked in the pharmacy business for almost 30 years. So here you go, two people with many years of experience when it comes to aged folks and falls prevention. So Bruce is going to share some essential information related to falls preventions with you first, followed by Christine's presentation. Bruce?
Hello, everyone. Thank you for coming. I just want to say briefly, and then I believe you get an opportunity to ask questions. This program, this is the second time I've seen it, and I just have to extol the producers, the writer, the play. I used to do theater myself a lot in school and community theater, so I really identify with that aspect. But the content, the delivery is, it's unmatched. I really hope that other organizations can promote and get this aired to as many people as possible. But speaking to you, the participants, I'm sure some of you could identify with Claire. Some might identify with the obstinate parts. Some might identify with the more open parts. But I'd like to speak very briefly to the fact that if you've already had a fall and you've been forced into a physical therapy situation because you didn't want to, or you're at the other extreme, you've actually tried to avail yourself to do some of these things that Claire and her friends were trying to encourage her to do, wherever you are in between, at any stage. With Jackie Osborne, a mentor of mine, who's very much responsible for getting me in this situation, for being a geriatric physical therapist, mentioned to find a physical therapist. We really are experts at looking at your total physical mobility and gait, where you are in a lot of things, because this is such a complex situation. What controls balance and falls and fall prevention? It's a really complex mountain that we have to sift through. So definitely go to a physical therapist. The other thing that she said, and this is huge, is getting up and down off the floor. Now, you need to be careful, but you need to be realistic. If you already know that you've been on the floor and you can't get up, and I'm not suggesting that you do that, but our society does not require us to get up and down off the ground to the floor like we're intended to as a species. And that one thing is something I won't show it to you, but I have a large red mat here that I do in the rehab studio here at AgeWell. That's a primary. A good physical therapist will put you through that in a controlled fashion. In the resource information that you'll be sending, the CDC has a whole series. It's called the STEADY program, which they're not messing around. They call it the Stopping Elderly Accidents, Deaths, and Injuries is what STEADY stands for. The government, our tax dollars, has spent a lot of time and money in producing a whole website dedicated to fall prevention and trying to address this problem that's very well outlined in the film. But part of your emailed information will be this self-survey of about 12 questions, and it's a great exercise to take, even if you don't think you're there, if you're not anywhere near there. Great, take all the 12 questions, get a no to all the questions and feel good about it. But by going through this, it'll force you to go through it. It is a validated, reliable instrument, which we use in healthcare for people to check this. And at the end, we recommend that if you score 4 questions yes or more, that you seek a physical therapy evaluation through your physician. So I think that's enough for me to say at this point. I don't know how the questions will come. Will they come on the chat? Is that correct?
Well, we will ask the questions once Christine has a chance to speak, and we'll ask
Okay.
of both of you.
All right.
Thank you, Bruce.
Thank you.
Christine?
Okay, there we go. Good evening, everyone. Thank you so much for coming. That was really fabulous. I want to spend just a few minutes here, less than 5 minutes of your time, to talk very quickly about a few items with regard to medications and fall prevention. If we could go to the next slide. So the first couple slides are going to be relatively quickly. You will be receiving these so that you can study them more in depth. The real key takeaway points are towards the end. This first slide here just talks about different medical conditions and disease states which might increase your risk for a fall. You might think real quickly things that might throw your balance off, such as Parkinson's disease, multiple sclerosis. Lots of different things can cause you to have gait abnormalities. So these are some of the medical conditions. Next slide, please. There are also certain classes of drugs that are known to be increasers for risk for falls. Anything, of course, that can cause drowsiness or dizziness. What we think of very commonly are our narcotics, our opioids, such as hydrocodone or codeine, oxycodone. Also, as well, the benzodiazepines, when you think of things such as alprazolam or diazepam, lorazepam, certain antidepressants, most of them, as well as antispasmodic medications that you might take as well for muscle spasms. So we'll talk a little bit more. There's so many different little things here. I didn't want you to have to be burdened by a lot of different, memorizing a bunch of different little details. I want to give you some key points that you can carry with you. Next slide, please. This just shows a kind of a collage of some of the medications that can cause you to increase risk for falls. Next slide, please. Okay, so now we're getting to our key points. So when we're talking about the geriatric population, I do want to mention to everyone that as we age, we do tend to require less drug to achieve the same effect. Many times I hear people say things like, well, I've been taking that drug for a whole decade and whatnot. And truthfully, brings me to my second point here. What was a therapeutic dose, say 10 years ago, might actually be too high of a dose now. Your liver and your kidneys, your body overall changes. You don't break down drugs the way that you used to. So feel free to advocate for yourselves, speak out to your physician, your practitioner, ask them, you know, I've been on this drug for a long time. Could it possibly work at a lower dose? Talk to your pharmacist. Are there medications that I might not need that don't have an indication that I can get rid of, so that I am taking just as few medications as I can, which will hopefully decrease your chance of a fall in side effects. So the overall goal for patients should be to utilize the lowest dose to treat the patient's symptoms while minimizing the potential for side effects. I've seen many patients come into the emergency room and they were put on a medication that was perhaps the appropriate medication, but the dose was started 3 or 4 times higher than what we would normally see given to an elderly patient. So go ahead and ask your doctor, you know, is this the lowest dose? Can we start low and go slow? Next slide, please. Key points, if you can, if a medication is no longer applicable, it no longer applies to you, you do not have an indication, see about stopping that medication. Certain medications do need to be tapered off, so you want to check with your doctor or pharmacist for that. Sometimes you can also switch to safer alternatives. Maybe there's a medication that causes less side effects that might not increase your risk for dizziness, drowsiness, what we call orthostatic hypotension, which is when you stand up and you feel postural hypotension, you feel really lightheaded. Medications, a lot of times cardiac medications, diuretics can do that. But just ask your doctor, is there a safer alternative? And the next question, next little box at the bottom goes back to what I had said from before, reduce your meds to the lowest dose possible. And also, I wish I had added on here this little thing. If you can, try not to use medication to treat your condition. Try what we call non-pharmacologic interventions. See if there's something in your diet that can be altered that might improve the symptoms that you're having and decrease those symptoms without having to resort to medication. Next slide, please. Any new onset symptom, make sure you always double check it, if you have a new drug, if there's an increased dose of a drug or a discontinuation of a drug. So anytime you have a new symptom, think about your medication and how that might be causing that. And again, you always want to do a screening from your pharmacist for drug-drug interactions, because you have one drug, you add another drug, and now that could cause higher levels, which could increase your risk for side effects. Okay, next slide. Again, ask your pharmacist, I'm having this particular side effect. Are there any medications that might be causing this side effect? Next slide. And finally, I want to have everybody take away, if possible, that all medications do have side effects. So try to think of it almost like a scale. It's a risk versus benefit. When you're taking a medication, are you getting enough benefit to offset what the particular risks are? And if you can, try to educate yourself on what those risks are. I'm going to take this new medication. What do I need to watch out for? And is that appropriate? So everything is a risk versus benefit. So kind of keep that in the back of your mind when you're making your choices for your medications. And that's all I have. Thank you.
Thank you, Christine. We really do appreciate it. I want to ask Bruce if he would come back on as well. And as we have the two of you serve as our panelists, I just have a question for Bruce first. Bruce, how should people ask for a falls risk assessment? And what type of physical therapy should they see?
Well, all physical therapists are trained in balance in these things that we're talking about, but many have gone routes that are maybe separate from that. So it's great to, if you have a particular clinic that you like, or you're looking for one, to call and ask if they have someone who specializes particularly in balance, especially for those who aging, elderly. We hate to use these words, geriatric. So they don't necessarily have to be geriatric certified to be experts in balance. There's usually in every clinic someone who is very good at that. You do need a physician's referral if you expect your insurance, your Medicare, or whatever insurance you have to pay for the visits. Nurse practitioners, physician's assistants, DOs, other physicians, they are all, under the various laws required to make the referral in order for insurance to pay for it. You can go to a physical therapist directly and pay out of pocket. We're allowed to do that in the state of Florida, but it's usually cost prohibitive for most people.
Thanks, Bruce. You mentioned the falls risk assessment, and you said something about getting those 12 questions.
Yes.
One of our guests said that she looks forward to getting those 12
Yes.
questions, and she's excited about doing that. Can you answer for us? What do you look for during a falls risk assessment? What kind of things is a physical therapist looking for?
Well, what we're supposed to do is look at everything. It's holistic. You look at the medications, you look at the home environment. You don't necessarily do a home assessment, but you'll ask the typical questions of what's going on. If it is home health, of course, they would be conducting that. If they're coming into an outpatient studio, we do some of the normal things that physical therapists do. Balance is its own tenet in physical therapy. Then there's strength, range of motion, endurance. What is a person's actual physical capacity to move at all? So it's complex what we go through. Here at AgeWell, I get into it from a neurologic standpoint too. I have different techniques, screening techniques, and even equipment to measure a person's vestibular response, their sensory input from the rest of their body, as well as their vision, and how all these things work together to give the body the right information to respond in different situations. So assessments vary from one therapist to another, but it's important that they try to look at everything. And of course, the patient themselves is usually the best source of information of what their trepidations, what their anxieties may be, whether they've already had a fall or they're just really like the gentleman who fell on the bed. This is a great example. I mean, there are people who have much less significant mishaps than that really alert them to what they should do.
Thank you, Bruce. That's really good information for all of the seniors on the call, and actually for all of us, really. Christine, I'd like to ask you a question. You had some excellent recommendations for patients in order to minimize their falls risk by the way they took their medication, how they altered their medicines, and even you said to them, perhaps you might want to do some things that would help you just not take medication at all if you could possibly do that. Would you speak just a moment to about some of the over-the-counter medications that that people are prescribed? Are there any of those that they should be cautious of that our guests should know about?
Mm-hmm. That's a great question. Thank you, Lynn. One of the very, very biggest ones is the diphenhydramine, which is the active ingredient in Benadryl. It's also in the Tylenol PM. So people will take it before they go to bed at night. And the diphenhydramine is a very long-acting antihistamine. It gets all the way through your brain and into your body. It causes a lot of drowsiness and dizziness. If you've ever taken one, you know how you wake up in the morning and you get that kind of really sluggish, hungover kind of a feel. That's that medication. And normally it lasts in an adult about 7 to 8 hours, but in an elderly patient that probably has a decreased elimination from the body, it could last for 8 to 10 or more hours. And so you think you're good because you took it at 10 p.m. and you have to get up at 6 or 7 to do something, but that medication is still in your body. And And that could greatly increase your risk for falls. Also, the similar medication is something called doxalamine, which is in the Unisom tablets as well. So you have to be very cautious with any of those that promote sleep in particular. So that's the really big one that you really need to be careful. Anything in the antihistamine family, but especially those two.
Thank you, Christine. Good information, really good information. So Bruce, there are some questions in the chat around age, and one of the questions which I saw you typed an answer to, what's the earliest age should a person get a falls assessment? And I want to ask this question for those people who perhaps may not be able to see the chat and see your response to that question. Is there a particular age that you should have a falls assessment? Is it like some of the other testing that we need to do at a certain age?
There's no magic number. There's no magic number. It's really important to understand that the whole system of balance and control, mobility, is a skill, and everybody has different levels of skill. What we consider normal balance is a very, very abstract mark to try to hit. So anyone who's having any concern, the earlier the better. If it really depends on your lifestyle and how active and how vital you are as a human being, as the animals that we are already. And the warning signs can be other things, whether there's something profound like a disease, diabetes, or neurologic problem. But many people who are having some worries about their overall health would benefit from a physical therapist assessment. There's not a particular age. Of course, there's the magic age like we have here at AgeWell, that's 65, but that's more related to Medicare benefits than anything else. So I'm tossing off this age question. Any age would be appropriate.
Okay, thanks, Bruce. That is good information. We all need to know that. I do have a question that someone asked, and I don't know, either one of you can answer this one. It has to do with devices, emergency devices. And she wanted to know, is there data on the effectiveness of the emergency buttons that elders sometimes wear? What are your thoughts around that, Bruce and/or Christine?
Oh, quickly, I would say there probably is data. I'm not aware. I would only be able to offer anecdotal opinions about them. By and large, they've become extremely sophisticated. I mean, maybe even overly so in some cases. The watches have fall potentiometers, accelerometers, which can tell whether someone's falling. It used to be the more typical one was just a telephone-based home base. It was only good at the home. Now there's the ones that you wear that are actual cell phones, which are far superior because they work much further away from the home and anywhere where there's cell service. Of course, if you fall in an elevator, you may be in trouble. So there's a lot of technology available for this, but none of it is going to, I mean, that's great for emergencies, for handling an emergency of the fall that's already happened. But obviously, I'm more interested in trying to prevent that fall from happening in the first place. But there's so much information. I would look at the, if you're considering one, be a good shopper and look at what the reviews are for those devices.
Christine, would you add anything to that?
No, actually, I thought that was excellent. I'm sure there is data we can look into, perhaps finding some of that to let you know and to piggyback and follow up on that. Definitely worth looking into.
Okay.
I will add one more thing. Some of the obvious things are, is the person going to wear it? Are they going to use it if they are wearing it? Is it charged up? It really boils more down to the human aspect, your practice and your familiarity with it and your knowledge of it than anything else.
Okay, sounds good. So we have a question in the chat, and I'm going to allow that person to ask their own question, and that's Joanne Hickox. Joanne, unmute yourself and ask your question.
Just real quickly, being a younger person, what can I do now that will help me age better balance-wise?
Oh, okay. Well, if you're without doing an assessment on you, I can't tell you exactly, but whatever you're doing well that you consider well and you feel comfortable with, continue doing it. A big thing I bring up to a lot of people, all my patients, if you're a dancer, if you enjoy dancing, there is nothing better than dancing, whether it's with a partner or if it's Zumba, if it's music based, and you enjoy those type of activities that employ both cognitive control, which is very sophisticated. Dancing is a very sophisticated music language based system. That is an extreme. It's the best method of toning the system. I don't mean just the muscles, but the entire system for preventing falls. If you're a good dancer, you're going to be much better at staying on your feet, literally.
Thank you. Thank you
That
very
was
much.
helpful.
That was helpful. I'm sure it was helpful to Joanne. She is really good about asking some really good questions. But Christine, before we go, and our time is certainly far spent, I wanted to ask you in terms of medications for falls prevention, did you notice through the documentary if Claire was relatable, or have you ever heard any of the incidences or any of the descriptions that Claire gave us from any of the patients that you have had to interact with when it comes to medications?
I thought that that Claire was very relatable. I think to kind of piggyback on Claire a little bit, the things that I find with patients that I hear the most, only because it's more of a medication standpoint, would be we will do a medication assessment on a bunch of different medications that could very significantly impact the risk for falls. But then when we're all done, the patient decides they don't want to make any changes. Some people are very, very motivated to make changes and adjustments. Some people don't want to make any changes. And again, that's what I'm trying to stress, is that as people age, they tend to require less medication. So it is important to try to back off and taper off some of those different medications. So that's probably the biggest barrier that I see is people, some people are very motivated to make changes, and other people are just, no matter what, they just do not want to change their medications. So I would like to encourage everyone to keep an open mind as much as possible, because like they said, once you get over so many different medications, what might end up happening is you end up taking a medication, you get a side effect from that medication, so they give you another medication, which causes another side effect, so they give you another medication. It's what we call a prescribing cascade. So just try to avoid that if at all possible.
Thank you very much. And we would really like to thank both of you for your time this evening and serving as our panelists and sharing just a wealth of information with our guests this evening. And I know that it's information that they will be able to use and take back with them and apply it to their own lives, and also to share it with their parents, those who perhaps are on the call that are younger. Bruce, not necessarily ready for the assessment or feel that they're ready for the assessment, but this is good information even for me. So I really do appreciate you and appreciate your time. And now I am going to turn it over to Zavanya, and she's going to close us out. Thanks again, Bruce and Christine.
Thank you very much.
Hi, everyone. Thank you for coming.
Thank you.
Thank you for having us.
Well, that was awesome. Thank you so much again, Christine and Bruce, and thanks so much to Ames Productions for providing us with this awesome presentation. So I just have a few closing announcements that I want to make sure that I share with you all. So as has been mentioned, there will be a few electronic takeaway handouts that will be emailed on tomorrow. So please be on the lookout for that. I've also posted a very, very brief survey for tonight's session in the chat. So again, thank you so much for those who have been responding to those surveys. It is a great help to us to continue to deliver you all this pertinent information. So please take a moment to participate in the survey. And then we also are going to be hosting another session next month on diabetes. This was one that has been requested in our surveys for the last couple of months. So we would have been able to secure a speaker, Dr. Trishella Foy, who will be talking with us next month on diabetes. So please be on the lookout for that flyer, and you will be able to pre-register for that starting tomorrow. And then lastly, please take a look at our future sessions. August 23rd at 6 p.m. we will be having a session on nutrition, and we are in the works of confirming our fall sessions as we speak. So we continue to look forward to meeting you here for these very important education sessions. It is our purpose and desire to make sure that our communities are informed and that they stay as healthy for as long as we all can. So thanks again for spreading the word about this session. And we hope to see you again next month. Good night, everyone.